Welcome back, everyone, to BBB Sharing. I'm Evie, Director of Ignite, sparked by BBB. We have our President and CEO, Barry Morin, here with us.
Hello, Evie.
Hello, Barry. And of course, we have a very special guest who came and
do.
spoke with us today about UV radiation. We have
It's
Dr. Andrew Poklepovic with us today.
Hi,
Thank you
how
for
are you
coming
all?
in.
Did she say it right?
She did. It was perfect.
Oh, thank you.
Or on YouTube also. Love it.
I get nervous about saying people's names. I always want to make sure I get them right. So
Well, tell them your first name.
the full one?
Full one.
The full one is Avanthia.
Avanthia.
About that.
Yes.
Only one doctor got it right, and that was Morales.
That's right. Well, he kind of cheated, I guess,
Yeah,
because he's Greek.
He's
so.
from Greece, yeah.
But you came here today, you talked about UV radiation, you had so much information and you provided an amazing PowerPoint. I guess for those that didn't get a chance to be here today and listen to it, what's the one thing you hope people walk away with?
I think I want people to think about sun hygiene and taking care of their skin when they're out and about and in the sun. You know, sunburns are never good, but you don't even have to get a sunburn to get sun damage from UV radiation. And it has a lot of things. It can lead to premature skin aging. It can lead to skin cancers and all sorts of things that you don't really want. And you don't need to expose yourself to it to live a happy and healthy lifestyle.
I agree.
Yeah, I learned a lot.
I was gonna say, Barry likes to sit by the pool.
It was two of us in that room. I'm not gonna say the girl's name. It was me and another lady in that room during your presentation that we like to lay out on our weekend. We come back and talk about it when we get together without any suntan protection or lotion or other than sunglasses. And I learned that was a good thing. But I think we're making a big mistake, aren't we? It's Russian roulette, or
Yeah,
like you said,
it's really exposure over time,
Yeah.
you know, and some people are going to be more susceptible to it than others, related to sort of your skin tone and skin color and just where you lived and when you grew up. You know, if you grew up in Arizona and did that your whole childhood, you'd probably have had more skin cancers. You know, if you grew up in Scandinavia where it's winter for 6 months of the year, you'll have less. And so it's really a cumulative lived experience for an individual person, but it accumulates over time. You know, people that have skin cancers on the top of their scalp, you know, they didn't lose their hair till they were in their 40s, and now they've got skin cancers on the top. That all happened after they lost their hair. So it's really about what you get throughout your life. When we tell people who are quitting smoking, it's never, you know, too early to quit. Quit now and you'll reap the benefits for quitting now later. If you continue to smoke, you're continuing to add problems. It's the same thing when it comes to sun protection.
that's a great point.
Is a
Yeah,
great point.
I learned. I mean, did you learn a lot today?
I learned a lot today.
It's-
I grew up spending a lot of my summers, most of my summers in Greece up until COVID. And my mother loves the beach. I mean, that woman can sit out in the sun for hours on end. Whereas me and my siblings, we prefer sitting under the umbrella with a book. Don't know how she gave birth to the three of us, but she did. And for me, I never really thought about skin cancer because it just wasn't something that was ever addressed in our family. But now that I think about it more and more, my mom's like, "You're so pale, go get tan." I'm like, I don't know. I've read a lot of stuff. I don't think I want to go sit in the tanning bed. And that brings me to another question. People do go to the tanning bed still. They do like at least 2 or 3 times a week. Is it something you like absolutely don't do it or do it in moderation?
It's not thought of as being something you should do at all.
Okay.
Yeah, it's a lot of intense UV radiation in those beds. And it's certainly the kind that's going to lead to that premature aging.
Mhm.
Everything that's being done for vanity is actually, you know, you're going to be paying all those prices over time for it. You know, just the same thing as like, well, somebody shouldn't just smoke on weekends and sorts of those things. But it's the same idea about keeping yourself protected from those. And there's other ways if you really want to have darker skin. There are spray tans and things like that people do for special events. I think that both presidential candidates were doing spray tans about a month ago.
Yeah, you're right.
So
Yes.
try to look younger better. So
Yep.
you know, there is that long-standing cultural thing to say, well, tanner skin is more youthful, more vibrant. You know, you go back hundreds of years before that, and paler skin was in vogue because it meant you didn't have to do manual labor. You could stay inside. And so those cultural trends will shift based upon kind of who is driving that. And, you know, you're talking about your heritage from Greece. So my heritage is Croatian, which is directly up the coastline from Greece. And I always had olive tans when I grew up in Florida. And I was like, well, I don't really burn that much. I think I'm pretty protected to this Mediterranean skin. And then both my Croatian uncles who still lived over there got melanoma when I was a teenager and they were in their 50s. And so that was kind of the wake-up call to me that, I'm not as protected as I thought I was. And that's what started the transition in my life. My best friend was diagnosed with melanoma at age 21. He grew up across the street from me. So like kind of in a back-to-back thing, I had two uncles and my best friend with melanoma skin cancer, and it really sort of changed my outlook. And it's really about what you don't want.
Yeah, that makes sense.
Yeah, I learned a lot, and we're gonna wrap it up, but we learned a lot today. Cause I've got one friend my best friend went through radiation. And I had gone through it also. We compared notes on that. His was around the neck area, mine for prostate's a little different area. And then another lady I know that's had it cut out over years, decades. And so today is really exciting to learn the changes we made. So people could do more research. I'd love them to find out, how to get appointments with VCU. Massey is an accredited business. And by the way, did you notice my shirt today?
I did
I
notice.
bought a shirt just for you, Dr. Andrew. Sun is all over it. But how do they get it? Do they come to UV or VCU? Medical, what is?
So the Massey Cancer Center offers comprehensive care for patients with cancer, early stage cancers, late stage cancers, second opinions, and everything in between.
Yeah.
The health system as a whole has specialists in all aspects of healthcare. So if you have a kidney problem, you can go there for a kidney issue. When it comes to cancers, we're at this inflection point of, in general, patients go to see an oncologist once they've been diagnosed with a cancer. And maybe with early detection tests that are emerging on the horizon, people will come with hey, I'm worried I might have cancer, and this test said somebody needs to work it up. But right now, it's your primary care doctor or a specialist like a gastroenterologist or a lung doctor will find the cancer and then make the referral into Massey. We're happy to see people for second opinions. People can come get an opinion for what Massey would offer and choose to stay where they are, or they can choose to come. It doesn't matter. It's really all about the patient. One of the things that sets Massey apart is its commitment to research. We were talking about the changes in life expectancies for patients now with these modern immune therapies for skin cancers and how it really transformed the game. Well, the people who were the first to survive an otherwise unsurvivable cancer were the people who participated in the first trials of those drugs. And so my philosophy towards cancer research is it's an opportunity for tomorrow's treatments today.
Yes.
And that is probably the most important take-home point about why you want to be seen at a place like Massey, because they do pay attention to what's on the horizon, what's coming next, and we curate our portfolio of studies to make sure that we have options for patients.
Yeah. And I'm a big fan. We're lucky in Richmond, and I try to get this word out. You don't have to travel down to 2 states south or up to the nation's capital area for hospitals. You can get cared for right here. Massey has got an unbelievable amount of team members that are just phenomenal. And, Becky Massey and your board, Debbie Johnstone, she was going to be here today and something came up. And then Dr. Wynn, I just think it's amazing. So thanks for working here for Richmond and all your patients. Really appreciate it.
Absolutely.
Thank you for coming in today.
Yeah.
Thank you all for inviting me. I look forward to my next opportunity to come back.
Doing great. And Evie will wrap it up. She's got always.
Say my
She
spiel.
takes us out.
Thank you everyone for watching and listening. If you're watching on YouTube, make sure to like, share, and subscribe and comment down below. It helps the algorithm. If you're listening on Spotify, of course, do the exact same thing and make sure you share the love. And please, please, please go back and watch. We have recorded the presentation that is also going to go up on YouTube and be one of the episodes on our podcast. So make sure you listen to it.
Awesome.
Thank you.